I actually read somewhere that acne is like one of the top runners that causes depression in a lot of adolescents and young adults.
I
Totally.
believe it.
Makes
Yeah.
complete sense.
And I think, I mean, personally, I don't know about you guys, but back when I had acne, when I went to the dermatologist, their main priority was just controlling the acne, which is great, but they don't really do anything after that.
Yeah.
Like
Right.
these scars stick around for so long and it
Yeah.
still contributes to the self-esteem issue.
Yeah.
Mhm.
And they don't really address how to fix that.
Exactly.
Mhm.
So that's kind of where we come in.
Yeah.
Yeah.
Yeah. We're
So
here for you.
We feel you.
Yeah. Welcome to AP Class, your virtual journal club for all things aesthetic medicine. Created by injectors for injectors, this is where we take a clear, evidence first look at the research shaping modern aesthetics. Each episode will unpack a study, what's solid, what's questionable, and how the evidence informs natural, refined results in real practice. Class is now in session. On today's episode of AP Class, we're reviewing a split face comparison study examining whether platelet-rich plasma combined with microneedling offers meaningful advantages over microneedling alone in the treatment of post-acne scarring. We already know that microneedling alone is an effective intervention, but does adding PRP enhance outcomes or simply add complexity? Let's take a look into the research and dive in. Welcome back to AP Class. I'm Megan Usage, nurse practitioner.
I'm Aisha Patel, PA.
And I'm Sarah Perchek, physician associate.
We are the providers here at Radiance Wellness, and we are coming to you with AP Class. So today we're diving into one that's near and dear to our hearts. It is microneedling over acne scars. This one I think really resonates for a lot of people, especially in aesthetics. I know we've all talked about it. We all struggled with acne. Some of us acne scarring. I know I had to go on Accutane when I was a kid. Did you guys do Accutane?
I had to
I
go on
did.
Accutane.
You did?
I
Mhm.
asked for it, and then the dermatologist was like, "No."
Ugh.
Oh no.
Yeah, but
But I wish I
acne,
did.
right?
Yeah.
I honestly, like, for so many people, I feel like my threshold now is low to be like, maybe you need Accutane
Yeah.
because
Yeah.
it has such a profound impact on your self-esteem.
Right.
Acne is, especially at that age when you're young in your teens and
Yes.
20s, and it really can change the trajectory of your life. And for us, I know that it did. Like, we got into aesthetics because of that passion, because it was
Yep.
something that was near and dear to us. So I love that we now can help treat people that are going through similar situations and help improve their quality of life. So,
Yeah, I went to PA school because the nurse practitioner that treated my acne when I was younger changed the trajectory of my life.
yeah,
And I was like, that's what I want to do.
yeah,
I want to help kids with acne. And I actually did my thesis in PA school about Accutane.
that's amazing.
Wow. I actually had a similar story. I found the PA profession because I went to the doctors looking to treat my acne, and
Oh
the
my
provider was
gosh.
a PA, and I was
Yeah,
like, "Oh wow, like that's
Oh my
cool."
gosh, I love that.
yeah,
Yeah.
yeah. My first taste into aesthetics was my nurse practitioner, primary care NP, was like, I think you should go get microdermabrasions for your acne.
Oh my gosh.
And so I went to like a cosmetic place to get microdermabrasions, and I was like, this is a cool world. I like this.
I want more of this.
But for so many people, even after the acne has cleared, there's still this whole other realm of acne scarring, which
Yeah.
still can have a profound impact on people that
Right.
lasts for years.
Right.
So this study is really looking at that. We know that microneedling is incredible for the skin. We know it's incredible for acne scars, but now we want to look at adding in PRP. How does that change the efficacy of microneedling? Can we see better results for our acne patients by adding in some PRP to their
Yeah.
treatment? And we'll go over what PRP is. But so this study is called a split face comparative study of efficacy of platelet-rich plasma combined with microneedling versus microneedling alone in treatment of post-acne scars.
Wow.
Yes.
Whew.
It's a mouthful, but you got
They
it.
should really try to like cut down the titles.
Yeah.
I know.
Just keep it concise.
Yeah.
All right. Well, I guess we can't really speak. We don't write research studies,
That's
so we should
true.
probably just, stick to our lane.
Stick
Let's
to
just
the
stay in our
analyzing.
lane.
Stick to
Yeah.
analyzing. So let's get into it. What did they do? What did they find? Most importantly, how does this change the way you treat patients or as a patient?
Yeah. So let's first talk a little bit about acne vulgaris and how it's more than just a skin condition. it is very volatile skin condition, and scarring afterwards and during is very, very common.
Mm-hmm.
And it's not just physical, it's emotional. There's a huge psychological effect on patients that have this. So it affects their, how they feel every day, what they look like, their self-esteem, depression, and it's really lowers their quality of life, especially since it hits in those transformative years when you're young, 14 to 20 or even longer. And a lot of people don't even know that there's treatments.
Yeah.
So it's really important that we find a treatment for our patients that are suffering with these acne scars, to help them through that difficult time. And so, talking about treatments a little bit, there's a lot of treatments out there for acne scars. There's chemical peels and lasers, microdermabrasion. There's resurfacing agents, but microneedling, time and time again, has been a go to for a lot of patients because it's accessible, it's affordable, and it has, really great results when it comes to resurfacing the skin and helping build collagen.
Yeah, and I think what's so tricky about it is that collagen is so compromised,
Right.
right? And that's why microneedling is so amazing because you really need to kind of reorganize that very disorganized
Yes.
collagen that's under the
Yeah.
surface of the skin. And you need to kind of break it up and lay a new foundation. And that's hard to do.
Yeah, there's also minimal adverse effects after this. And in this study, I'm glad they treated patients with a slightly darker Fitzpatrick because it shows that there's limited or minimal post inflammatory hyperpigmentation with this treatment.
Back to the depression part, I actually read somewhere that acne is like one of the top runners that causes depression in a lot of adolescents and young adults.
Totally.
I believe it.
Makes
Yeah.
complete sense.
And I think, I mean, personally, I don't know about you guys, but back when I had acne, when I went to the dermatologist, their main priority was just controlling the acne, which is great, but they don't really do anything after that.
Yeah.
Like,
Right.
these scars stick around for so long and
Yeah.
it still contributes to the self-esteem issue.
Yeah,
And they don't really address how to fix that.
exactly.
So that's kind of where we come in.
Yeah.
Yeah. We're
So-
here for you.
We feel you.
Yeah.
So this study is primarily looking into PRP with microneedling. So we know PRP is an autologous preparation of platelets that release growth factors like PDGF, VEGF. These are your intrinsic growth factors. So your body creates them.
So that means your body is making them
Yes,
for people who know
so-
autologous or
Autologous.
Autologous.
So
Autologous.
it's self-made is what I learned.
Yep.
So it's not your PDGF that's made outside of your body.
Right.
And the theory here is that it creates, it releases these growth factors that work synergistically with the wound healing cascade that's triggered by microneedling. And that's what's creating that collagen and tissue regeneration. So I think this is a huge thing to kind of look into when we are treating our acne patients, whether there's a missed opportunity if we're not treating them with that PRP or just doing microneedling alone.
Yeah.
And now people hear differences like we use PRF, right? So there's like
Yes.
PRP, PRF. They're both coming from the same place.
Yes.
Just boils down to the concentration of those growth
So
factors.
PRF has that higher concentration of fibrin, which is that protein that, gets that collagen going. So they're both great. PRP or PRF is a little bit better in a sense just because it's a higher concentration.
Yeah.
Yeah. And this is stuff that's used in orthopedics all the time too, right? I have some
Yeah.
patients that tell me all the time they, knee injections
Yeah.
into bad joints. One of my patients was saying in infertility, they injected PRP or PRF into her fallopian tubes. After like failed IVF treatments, they did PRF and she got pregnant.
Wow.
Yeah,
That's
I think
amazing.
we're starting to realize that it's used for a lot of things. Joints, aesthetics, infertility. It's endless.
Yeah.
When we were looking for papers to do for this class, I kept coming up on these oral papers with,
Yeah.
gingival things for their gums and
Yes.
Oh,
teeth. And
yeah.
I was like, that is great, but that's not what I'm looking for
Can you
here.
imagine how much that must hurt?
No, I don't.
Yeah,
I try not to
PRP
think
and
about the
the
dentist,
I
but thank
know.
you.
Oof, yeah, my teeth hurt just thinking about that. But I saw that too. There's a lot in the dental field
Yeah.
with injecting that.
Mhm.
Cool. All right. Well, let's go over where the study lands in the hierarchy of evidence. So, thinking about that pyramid again, that kind of helps us determine like how much weight are we giving these findings. This is a comparative study. It lands in the category 3 or 4. So, it's below a meta-analysis, it's below a randomized controlled trial, but it's above an observational or an expert opinion. So, there is some sort of comparison happening in this study, and we'll get into the details of that. But there is always room for a little bit of bias. They may be underpowered because it's not a randomized control trial, and so those are just things to take into consideration. It is great that they did a split face comparison. That's really helpful in dermatology when you're trying to assess because it takes away some of the noise. Which Sarah, I
Hmm.
think you explained that really well. Like when you have two people, it's like, well, our skin could heal differently.
Right.
Maybe I have more acne than you have, but when you're doing it to yourself on both sides, it takes away a lot of that noise. So it was
Yeah.
great that they were able to do that.
Yeah, it's like the same skin,
Yeah,
same scars, same healing capacity for the
right.
patients that they
Right.
picked. So that was really cool. So kind of getting into the design of the study, this actually really matters when we're kind of breaking up that evidence.
Hmm.
So to start with the population, they picked 30 patients with Fitzpatrick's 2 to 4, sourced from a dermatology clinic in Bangalore, India. So this was kind of cool being brown
Yeah.
myself and having acne and scarring. It was kind of interesting to see what the results that they found.
Mm-hmm.
The patients were aged between 19 through 35. So the mean age was around 25, and 60% of them were male.
Mm.
So all the patients had acne scars. So there were
Hmm.
either rolling scars or box
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 Say
scars.
it 10
box
times fast.
scar
Yeah.
Boxcar, boxcar,
scars
boxcar.
and our ice pick scars.
What did you call it earlier,
A
Sarah?
pickaxe
Pickaxe
scars.
Pickaxe.
and then
Just
axe
pick.
pick.
Yeah.
And then axe pick. Just
Yeah.
couldn't get it right.
I mean, that's what I would imagine if someone came at
Yeah.
me
Yeah.
with a tiny little axe pick.
Yeah.
That's
Just
what it
like,
would leave it behind.
Yeah, exactly.
yep. Hmm.
So they were all scars that were moderate to severe in severity.
So that was the inclusion criteria. And so there was a lot of exclusion criteria as well. They wanted to make sure that none of the patients had any tendencies towards keloid scars.
Hmm.
And they also wanted to make sure that patients didn't have any active acne. It was just scarring. And that's not to say that active acne is a contraindication for microneedling.
Right.
That's just not what they looked at in this study.
Hmm.
The other things that they wanted to avoid were obviously anybody that was pregnant or lactating and anybody with bleeding disorders.
Hmm.
So basically, anything that could inhibit healing or results. And the way that they looked at the results, they started with a scar grading scale
Hmm.
called the Goodman Barron scale.
Yep.
And that basically stages the scars from 1 to 4. And so they didn't include anybody with a 1. Those are like macular scars that aren't raised and don't have any depth. And they took people with scars that were a 2 to a 4. So the 2 are atrophic scars, hypertrophic scars, the rolling scars.
Right.
And then 3 is the box scar, plus the rolling scars, atrophic scars, hypertrophic scars. And then 4 is the ice pick scars,
Hmm.
the box scars, rolling scars, and tunneling.
Hmm.
So the 4 is obviously the worst
Mhm.
level to have.
Yeah.
So when they were choosing what scar types to let in to the study, they chose types 2 through 4,
Hmm.
and those are the people that they decided to do the microneedling on.
Right.
So, microneedling, the way that they did the treatment was I thought it was super interesting. They used a derma roller,
I know.
which we don't use often in our professional practices.
No.
But that
No.
No.
but it was interesting because the needles were at 1.5 millimeters.
Yeah, which I think is an important call out so people aren't like going on Amazon like I could get the derma
Yeah.
roller. Like
Yeah.
so this is like a sterile.
was a very deep
Yeah.
derma roller, but it's interesting because that's probably what they have the most access to
True.
there. Whereas we have Skin Pen and
Yeah.
other apparatuses like that.
Yeah.
You know, they used a derma roller
Mhm.
with 1.5 millimeter needles,
Mhm.
and there were like 192 needles on each drum.
Yep.
And the practitioners who applied the treatment went vertically back and forth, horizontally back and forth, and then diagonally in each direction to make sure they really covered all of the surface.
Yep.
And then the right side of the face was the face that was the face. The right side of the face was the side of the face that received the PRP.
Mhm.
And it was applied topically after the procedure, but also injected intradermally in
saw
the
that.
superficial layers, which I
Mhm.
thought was really interesting because
Yeah.
we microneedle our PRF
Mhm.
into the skin when we're doing it and apply it afterwards. But I thought it was cool that they didn't do it until afterwards and then they also injected it.
I know. I thought that
Yeah.
was an interesting take
Yeah.
too, is to maybe go in after you've microneedled or before and inject into the scars a little bit
Yeah.
with some of that PRP or
Mhm.
PRF.
Yeah, so that's how they divvied up the face. So the right side got the PRP and the left side just received the microneedling.
Mhm. Perfect.
Oh, they also, the way that they did the microneedling was they did 4 sessions 1 month apart,
Yeah.
and then they had a 6-month follow up.
Yep.
And after each session, they did follow up after a week just to
Mhm.
make sure that there were no adverse events. They wanted to make sure people were wearing sunscreen, covering their faces, things
Right.
like that. And then after the last treatment, they followed up 6 months later.
Right.
Mhm.
And then they used those 2 scales. So there was the Goodman and Barron qualitative
Mm-hmm.
scar. So poor was there was no change.
Mm-hmm.
Good, 1 grade improvement. Excellent, 2 grade improvement. And then there was also the visual analog scale.
Yes.
That was the 0 to 25% improvement, 25 to 50% improvement, 51 to 75% improvement, or 75% improvement and more. And that was the one that they asked patients to kind of point to on the scale. Like, where do you feel like you are after
Right.
these treatments? So then what did they actually find? So, okay, we've got 30 patients. We split their face in half. The right side, split their face in
Sounds
half.
aggressive.
Right side, you microneedle it with PRP. Left side, you microneedle it alone. They found that 80% of patients showed some reduction in scar severity on at least one side of their face. But what's interesting is 93% showed improvement on the PRP plus microneedling side,
Wow.
where only 73% showed improvement on the microneedling alone side. So they definitely noticed that there was an improvement in their skin. More, I was going to say statistically more, or significantly more, but
Right.
we actually don't know that. But they did show some sort of improvement on the PRP microneedling side.
Yeah. And so when they looked at the degree of improvement, like you were saying, with the 2 score change, they found that 43% of patients achieved an excellent score on the PRP side of their face. And what
Mhm.
that means is, for example, they went from a grade 4 scar down to a grade 2. So there was a 2-level change
Right.
in the type of scarring that they had. So it improved. So it's a decline in the number scarring, but it's an improvement in their overall scarring because it went from a 4 to a 2.
Right.
So patient satisfaction also had a similar result. They said that on the PRP side, 37% of patients found a 75% improvement.
Mhm.
And on the microneedling alone side, only 3% reported a level improvement.
That's a
So
big difference.
just on patient satisfaction on the surface level, it does seem like adding PRP to microneedling is compelling.
Yeah.
Yeah.
Yeah. So let's pump the brakes a little bit. I feel like when we were reading the study and analyzing it, we're just saying like there was this buildup, like, oh my God, this is amazing. And then we're like, "Ruh, ruh, where is all the statistical analysis?"
Right.
So Unfortunately, they weren't really clear on any statistical analysis that they used here. We really didn't get any p values to tell us, was this a statistically significant finding? So,
Mhm.
again, that means for us, can you generalize this? Like, can we go out to our patients tomorrow and say with some sort of certainty that we can reproduce this over and over again? On this study, we can't because we didn't get that. We know, and we'll talk about, there's a lot of other randomized controlled trials that have looked at microneedling with PRP that do show that. But it was just a little bit of a bummer that that we didn't get that here, especially when they went through all of the work to do a split face comparison. Like, you're
Exactly.
setting yourself up for so much success there. You're controlling for so much of the noise by doing a split face. But then if you don't analyze it correctly, unfortunately, it can fall flat. This is why it's so important, especially for us as providers too, to go back to reading research and to not just look at the headline, because sometimes the headline can be misleading, to actually dig in a
Mhm.
little bit deeper and analyze it and look to see, does this statistical analysis make sense? Is there actually something reproducible for me here?
Right.
So it's just a little bit of a bummer because it was so close
I was
and then it
getting
just kind of
so
fell flat.
excited.
I
Yeah.
know.
Yeah. So they kind of threw a lot of percentages at us
Yeah.
A
without
ton.
any like confidence intervals or like formal hypothesis.
Right.
And there was nothing that kind of showed statistical significance. And they were analyzing so many different outcomes like patient satisfaction, physician grading, different scar types, and they weren't adjusting for the multiplicity.
Ooh, multiplicity?
Multiplicity, is that a word?
I think it is.
Yeah.
Yeah.
Multiplicity.
Yeah.
Yeah, so there's so many things that they were analyzing, but it kind of created like a false positive
Mm,
Hmm.
because there was no consensus on it.
Right.
yeah.
Yeah. So, I mean, overall, though, the sentiment is that the PRP side definitely had an improved
Absolutely.
response.
Yeah.
And, but it's interesting because when you have doctors evaluating the
Mm.
patient and then patients evaluating themselves, there's a big difference in the scoring there.
Mhm.
Yeah.
So it looks like that there's only 17 to 27% of the cases showed agreement between the physicians and the patients on
Yep.
their score. What they refer to that as is the flawless bias.
Mhm.
And that really means that patients had these expectations of
Right.
being flawless after the fourth treatment.
Mhm.
And so, even though most of them received an excellent score for reduction in their scar size and type, they themselves didn't see it as excellent because they had this expectation that their skin would be completely renewed and refreshed.
Right.
So the doctors are looking at him from an objective standpoint, and the patients are looking at themselves from a subjective standpoint. And so there was a big difference there, and they didn't really make any room
Mhm.
for or a basis for any of that
Yeah.
to
Well,
make it statistical.
yeah. Well, this proves that we are our worst critics.
Yes.
sure.
You
Oh my
know, it
gosh.
kind of matches there. There were obviously limitations in the study.
Hmm.
One being that the patients or the providers were not blinded. So
Mhm.
Yeah.
the physicians performing the procedure knew which side was getting treatment or which side was getting PRP, as well as the patients. So that
Hmm.
kind of scales or creates bias for the performance and the detection.
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 I should just make up words today.
I know.
I know. I
I
love
love
it.
it.
Yeah, so there was bias for the performance and detection, especially for the subjective outcomes like patient satisfaction.
Yeah.
That's just going to be a harder scale.
Isn't that so true though? Like, even with our own patients, you find that happens too. They walk in, I'm like, "Oh my god, you look so good." And they're like, "Oh, I feel like I look like shit." Or,
Yeah,
it's
exactly.
we are our own worst
We are.
critics
Yep.
always,
Mhm.
for sure.
Yeah.
Yeah. Yeah.
And so while it wasn't blinded, it also wasn't randomized. So the
Mhm.
right side of the face for everybody
Yep.
received the PRP, and the left side received the microneedling only. So
Mhm.
true randomization of the sides would have controlled for any asymmetry in
Mhm.
the scar distribution.
Totally. Yeah, and then that statistical analysis. So when you're doing a comparative study like that with that split face, you should be using a paired t-test, not an
Right.
unpaired t-test. The reason being is it takes out that noise we kind of talked about. So it's kind of like an analogy of like if you have 30 people that you want to see who likes chocolate ice cream and who likes vanilla ice cream, and you give one half, 15 people, vanilla ice cream and one half chocolate ice cream. Well, Sarah maybe just loves all ice cream.
I
And so
mean,
she like rates all the chocolate ice cream or vanilla,
yes,
whatever I gave you, the same, right? But so you have
exactly.
noise in there because you have people's preferences.
Yeah.
Instead, it would be like giving everyone chocolate ice cream and vanilla ice cream and then asking them which one do they like better. That's like a
Interesting.
paired t-test. So that helps to take out the noise and make sure that the data you're getting to actually is meaningful to what you're trying to achieve.
Yeah, I was wondering how I could be in both of the
I like all
groups.
ice
I like
cream.
all ice cream.
Yeah.
So, I mean,
The swirl.
yeah.
Yeah.
I'll be in the swirl group.
Yeah. What's your
Yeah.
favorite ice cream? Mine's Cherry Garcia.
Oh,
Yeah.
mine's okay. Don't judge.
I'm already
But every
judging
time
you.
I tell people it's mint chocolate chip, and they're
I
like,
love
that
mint
tastes like
chocolate.
toothpaste.
No.
No, I like mint chocolate chip.
Okay, right?
Yeah.
So good.
Little chips,
Little-
not big chips.
Ooh.
Yeah.
You like big chips.
I like big chips.
Okay.
Or
Oh.
like a mint Oreo.
Oh, love a mint
Oh.
Oreo. Ben
Sarah?
and Jerry's has a good one.
Mm.
I like a double chocolate with peanut butter
Oh,
in
all
it.
right.
Like
You're
a
a full chocolate base.
yeah,
Yeah.
just full
Love it.
chocolate and add that peanut butter in, and you won't hear me talk for hours.
Man, all we had to do was give one ice cream analogy and we just went completely off course.
Yeah.
Love it.
All right, reel us back in, reel us back in. The one other limitation would be PRP preparation is
Oh,
so
yeah.
variable.
Mhm.
And in aesthetics, and actually I think in medicine in general, when using PRP, there is no standardized preparation for
Yeah.
that. So they talk about their centrifuge time was 15 minutes. Very different than what we do in office. Some people are using PRP and they have that additive that's kind of part of the tube so that doesn't coagulate. Some don't. So it's also like my chicken soup might be different than your chicken soup and your chicken soup. Why do I keep bringing up food?
I don't know.
Am I
don't
hungry?
know, but we are very food centric.
We are.
Oh,
yeah.
yeah.
Yeah. But, so the PRP changes too,
The
right?
recipe
Depending on where you go.
changes.
So
Exactly.
those are other variables to take into consideration as well.
Yeah, I think the overarching sentiment of this paper to kind of bring it all together was that PRP added on to microneedling is improving the procedure for patients with acne scars.
Yeah.
It's increasing the effectiveness.
And this study isn't in a vacuum, right? So this was one study. There's a lot out there on microneedling with and without PRP. There's actually a meta-analysis that looked at 14 controlled studies. There was over 470 patients in that study that showed PRP with microneedling was associated with significantly higher odds, greater than 50% clinical improvement. So there's a lot of strong data out there. Again, it just goes back to each research study and really looking at the quality of the evidence. Yeah.
Yeah. And I think what this means for our patients when
Yeah.
they come in for acne scars, it doesn't say that, okay, microneedling alone, shouldn't be done anymore.
Totally.
We're
Right.
still doing it. It still gives great results.
Right.
But if we can boost that and give optimal results, then we are offering that PRP or PRF in our practice.
Yeah. And I think too, we always kind of counsel our patients, the quality of your blood matters so much, right? So
Yes.
back to that PRP prep, but like, are you on anticoagulants? Are you eating a healthy diet? Are you well hydrated? All of that affects your healing response and therefore your growth factors and what kind of treatment you'll get.
That's something I want to look into, though, because I want to be able to advise my patients on what type of diet to eat. And it's been difficult to find information on that. So if anybody listening has
Specific
any
diet.
specific ideas that
Yeah.
they can send over to us, that would be great
To
because
improve your
yeah,
PRP.
improve your yield.
Yeah,
How
yeah.
much you yield because I'll have a patient that's the spitting image of health and granted I'm going to talk about PRF here, but they yield such little PRF whereas another patient that I just don't think is as healthy or doesn't look as healthy or whatever, they yield so much PRF, and I just can't figure out the difference.
Yeah.
So
Yeah.
I'd like to look more into that.
Yeah. All right. Anyone have anything else? I feel like this was a good study. Again, a little bit of a lead up and then a little bit of a wah.
Yeah.
But we know the evidence is there. We know there's strong evidence. But I think this was a good learning lesson too for everyone listening why we read research and analyze it and critique it, because there are flaws, there are limitations. So, it's just helpful.
More than just what the title is.
More than just what the title is.
So
This is true.
I think also at the end of the paper, it basically says that microneedling with or without PRP is helpful for all of the types of scars. It wasn't just specific to one type of scar.
Yeah.
It's specific to all of the different types of scars.
Yeah.
So I think anybody with acne scars is going to benefit from either or of these procedures.
Yeah.
Yeah.
I also love that it was done on darker Fitzpatrick's too, because there's
Yes.
always that risk of, oh my God, am I going to hyperpigment? And because I'm more at risk for that.
Right,
So
yeah.
that was really reassuring too, to see that that
Right.
wasn't an issue.
I really liked that part.
Yeah.
I
Cool.
was interested to find how they found a Fitzpatrick too in
In
Bangalore,
India.
India, which
Yeah.
is South India. I was like, okay, that's interesting.
Yeah. Good point.
Yeah.
Yeah, if they're all Indian, you literally cannot be a Fitz too.
That's what I was
Right.
thinking. I was like,
Oh, that's really interesting.
ethnicity wise, how is that possible?
Like you're definitely a 4 or above.
yeah.
Okay.
Huh.
So
Got some expats in there, maybe? I don't
Yeah.
know. Something's going on. I also love that it was a lot of males. Shout out to our
Shocked.
men
I
that
was
want to take care of their
shocked.
skin, right? Like,
Yeah.
I love this. We need
I
more men.
like that it didn't even reveal that until later.
I know.
And then I was like,
P.S.
oh my God, 60% males. And I was like, oh my gosh.
We love that.
So surprising.
Yeah, so also great. And I do think for a lot of men that come into our practice, this is a common one. Acne scarring, microneedling, like, what do I do? What
Right.
do I do about this? So
Yeah, right.
love that for them too.
Yeah.
Awesome. Thank you guys so much for joining us on another episode of AP Class, and we will see you next time. You've been listening to AP Class, your virtual journal club for all things aesthetic medicine. If you found today's episode helpful, like and subscribe, share it with a colleague, and join us next time as we break down more evidence that helps elevate your practice. Until then, class dismissed.